Okay, so I am going to talk on needs of people with caregivers of people with disabilities in the Asian American and Pacific Islander community. Um, I'm Sumitra Murthy, and I'm the visiting clinical assistant professor in the Department of Disability and Human Development at the University of Illinois at Chicago. And I have a background in medicine from India. I've done my master's in public health from Northwestern University, and my PhD is in disability studies from University of Illinois at Chicago. And I'll explain a little bit more about myself when I talk about my research projects. But first, let's talk a little bit about the Asian American and Pacific Islander communities, or AAPI, that I will refer to from now onwards. So today we will talk about a general introduction on AAPI caregivers, some of the challenges that are faced by them, some of the structural and institutional barriers that they face, their unmet needs, and then how can service providers better support AAPI caregivers? What should the future research focus be on them? What are some of the policy recommendations for them? And then I'll quickly give an overview of the UIC, my university projects that I'm involved with in regards to this particular subject. And then conclusion. So first of all, some basic statistics and information about the AAPI communities. AAPI is one of the fastest growing population in the US. In 2023, the number of Asian Americans reached a new high of nearly 25 million, or 7% of the US population. The US Asian population has more than doubled since 2000. The number of Asian Americans grew from 11.9 million in 2000 to 24.8 million in 2023. Now, both the US born and immigrant populations increased significantly over this period. And, by 2055, the Asian American, Native Hawaiian, and Pacific Islander individuals are projected to become the largest immigrant group in the United States. And Asian Americans are not homogeneous. We know that the Asian American and Pacific Islander communities, they consist of 50 different ethnic groups that speak over 100 different languages. Along with much ethnic group difference, considerable variation in English proficiency, educational attainment, and also, citizenship status exist. Most Asian Americans have faced discrimination and exclusion while being treated as foreigners throughout their long history in the United States. So I really want to talk a little bit about what do they face in this country. 57% of Asian adults see discrimination against Asians living in the US as a major problem. And around 63% say too little attention is paid to race and racial issues concerning Asian Americans. And this is according to a new analysis of a multilingual representative survey of, more than 7,000 Asian adults, which was conducted from July 2022 to January 2023, if you see here. Overall, this survey showed that most Asian Americans, or AAPIs, experience discrimination in three broad ways. Those related to being treated as a foreigner, even if they were born in the US, being seen as a model minority, which I'll explain again later, and other discrimination incidents in day-to-day encounters or because of their race or ethnicity. Many AAPIs, they face the experience of being treated as a foreigner, no matter their birthplace, citizenship status, or their strength of their ties to the US. And this includes those who say that in day-to-day encounters with strangers in the US, someone has told them to go back to their home country, acted like they can't speak English, criticized them for speaking a language other than English in public, or they would have mispronounced their name. Now, AAPIs have often been upheld as a model for how other racial and ethnic minorities should behave, especially in comparison with Black Americans or Latinos. Despite the socioeconomic diversity among US APIs, they are commonly portrayed as, educationally and economically successful, deferential to authority, unemotional, and lacking in creativity. And some of the day-to-day encounters that include being, for example, holding back them at a security checkpoint for a secondary screening because of their race or ethnicity, being threatened or attacked because of their race or ethnicity since the beginning of the COVID-19 pandemic because of the hate. So these are some of, like the discrimination that they have encountered, and also some of the stereotypes that Asians in the US have. Now, let me give you an overview of specifically caregiving in the AAPI community. Most AAPI caregivers are first and second generation immigrants. And among them, there are some common traits such as strong family values, emphasis on education, preserving traditions, and valuing personal relationships. Um, Cultural values and traditions greatly influence AAPI caregivers. 1 in 5 Asian Americans reported being informal family caregivers. Now, while there is very little that is known about the health outcomes, 1 in 3 caregivers report that caregiving has made their health worse. And many report, higher levels of emotional stress compared to other minority groups. And comparatively to their white counterparts, Asian American family caregivers spend more time providing care, they utilize less formal support, and they have also been very depressed. You know, Despite this disproportionate burden and high levels of perceived need for mental health support in their communities, AAPIs are less likely to seek help than other racial and ethnic groups. Next, let's talk a little bit about the cultural impacts on caregiving. API caregivers may be influenced by cultural values and traditions that have long lasting impacts on the caregiving role. This may also affect outcomes related to accessing resources related to caregiving, as well as their own coping as a caregiver. Although there is much diversity within the broad API ethnic category, um, there are certain pan API values that kind of underlie some similarities in family practices across many API subgroups. Um, Cross national examinations have really identified 4 themes that are common. One is collectivism. Collectivism is the tendency to place group needs and goals above the goals and desires of the individuals. A relational orientation, again, is a cultural frame in which, the self is defined in terms of its, you know, um, really essential and continuing interdependence with others. Then there is something called familism. Now, familism is actually a hierarchically organized family system, an extended family system as the basic social unit. Some API communities also are influenced by familism, and it's a belief that needs of the family they hold greater weight than the needs of the individual. And for many API caregivers, this means the role involves a long lasting commitment. Now, family obligation includes both attitudinal and behavioral responsibilities in which children are expected to show respect and affection for older family members. They seek their advice and accept their decisions, and then they maintain a proximity, and then they provide instrumental assistance, and then there is also emotional ties with parents across the lifespan. Now, filial piety is of great importance, and this is defined as obedience, devotion, care and respect towards one's elders, including parents and older family members. And family interdependence creates ecological challenges in the context of acculturation in AAPI families, where the individualistic goals, um, maybe subsumed by goals that are chosen by family elders. And filial piety partially explains this high rates of caregivers observed among AAPI communities. And caregiving is actually essentially a part of culture. Again, having said that, caregivers of different AAPI backgrounds differ from one group to another in kind of expressing their filial obligations or family relationships in their daily lives. Um, Research has shown that both familism and filial piety, as cultural norms in different ethnic communities, they have both positive and negative impacts on caregiving experiences. Now, similar to familism and family relationship, religion also influences the perceptions of caregiving across these different AAPI communities. For example, there's Confucianism, there's Buddhism, Hinduism, Islam, Christianity, Taoism, and these are some of the religions that guide caregiving processes, which are very unique to this ethnic group. Now, although a little research has been conducted on the attitudes of various Pan-Asian groups towards various disabilities, that could be like Down syndrome or like deafness or polio. It is clear that different cultures interpret disability in different ways. For example, some Asian American families may think disability results from disobeying a higher power or God, or is the work of an evil spirit. For others, disability may be seen as bad luck or, punishment for a sin that was committed by their ancestors or karma. You know, Others may see it as a good fortune or a blessing as well. But whatever the cause of the disability, many AAPI caregivers, they tend to rely on family members for support before they seek any professional help. And usually tend to distrust governmental agencies, and therefore they may not immediately seek assistance from the state VR systems. Um, and also because they are culturally committed to caregiving, many of the AAPI caregivers are usually reluctant to use respite services or in-home caregiver services or even long-term care facilities. They tend to take on the caregiving responsibility alone. And now coming to underrepresentation in caregiving research. Despite the growing number of older AAPI communities in the United States, these groups remain really underrepresented in, aging and caregiving research. One of the major issues with AAPI data is that it's aggregated. Okay, and therefore it loses its unique cultural contributions of ethnicities and cultures of these groups. Generalizing AAPI caregivers as a large racial group with similar Asian values, it actually masks these ethnic specific differences or characteristics. Um, for example, I would like to give this example from, you know, a 2017 National Survey of Child Health Data that was done in Maryland. And they reported that no Asian American caregivers of children with autism were included in this survey. Now, this is a national sample. It is a sample, and it provides rich data on children's lives, including physical and mental health. access to quality health care, and child's family and social context. But it's surprising that, no Asian American caregivers were included. In addition, a recent review of research that was focused on East Asian parents of children with developmental disabilities, that revealed that, existing studies use mostly, qualitative methods, had small samples. They were concentrated only in large metropolitan areas. And it was just Asian data, and it was not specific to any particular subgroups. With that background, I think we should look into what are some of the major challenges that are faced by AAPI caregivers. Now, the challenges that are faced by the AAPI caregivers, they are a combination of issues mainly related to individual factors and systemic issues. First, let's look at the model minority myth that I mentioned to you before. AAPIs, they're often labeled as a model minority because of, a perceived, a perception that they successfully adapt to American life, perhaps due to their higher income and education levels than those of other minority groups. And this is a false perception, and this is which was usually derived from very limited studies focusing on large, AAPI communities. And the large communities are like Asian Indian, Chinese, Filipino, Japanese, Korean, and Vietnamese, and on which the census really collects and reports data separately. Now, this often masks the social and economic needs of the caregivers, especially. Well, this group also struggles as other ethnic minorities do, for example, with employment opportunities, language and cultural barriers, and also the necessary skills to navigate the American system effectively. So, the impact of the model minority myth is a challenge. Next, let's talk about language and communication barriers. Studies have shown that approximately 30% of AAPI in the US have limited English proficiency. And language barriers, they present significant challenges for AAPI caregivers, and that leads to, impacting their ability to navigate systems, access information, and also communicate effectively with service providers. Now, many Asian American seniors, especially if they are immigrants, they have limited English proficiency, leading to difficulties in, understanding instructions, accessing services, and also receiving culturally competent care. For example, language barriers can make it really difficult to find doctors and healthcare providers. Sometimes even understand insurance information, and then it also makes it difficult for them to access necessary services like transportation, and also like getting support groups. Moreover, another important barrier for underrepresented groups is like lack of interpretation services at various service settings, lack of educational materials in their own language. um, well, interpretation services, they are offered in maybe some instances, but it is limited mainly to languages of, the larger, groups that I mentioned, like such as Chinese or, Hindi or Korean. That's all. And even when there is a translator, caregivers have reported that the translators are not qualified. They do not have adequate background information and knowledge in both their native language as well as English to interpret correctly. That is shared by, by the professionals. And so it's not efficient enough. And that kind of leaves out critical details. So language barriers, they also prevent AAPI caregivers from being fully aware and comprehend, disability related laws and, service systems in the United States. For example, sometimes caregivers have a hard time understanding the individualized education program or the IEPs. So, language and communication barriers is one of the major challenges faced by AAPI caregivers. Well, there are limited culturally appropriate services as well. AAPI caregivers, they face significant disparities in accessing culturally and linguistically appropriate services. Service systems are often ill-equipped, to kind of address the unique cultural norms and language needs of the AAPI communities. Many of the AAPI caregivers, they report difficulty finding, providers who speak their language or understand their cultural expectations regarding care. Additionally, mainstream disability services may not align with their own cultural practices, and their cultural practices are what, like, in home care and intergenerational responsibility. And what that leads to is underutilization of available resources. Now, the stigma associated with disability in some AAPI subgroups can also lead to isolation and also reluctance to seek help, particularly when the service providers, they lack cultural sensitivity. Now, like, these are all the issues, but what exacerbates everything is that AAPI caregivers are underrepresented in national caregiving data, as I mentioned before, and that makes it very difficult to advocate for, targeting funding or program development. Well, another challenge that they face is immigration related concerns and legal status. Now, history of immigration plays a very important role in the mental health of AAPIs, including the caregivers. Research again shows that, AAPI older adults with more recent immigration history, they're at a higher risk of, like anxiety, depression, loneliness, and isolation. And then, why does this happen? Some of the reasons why this happens is because of their loss of, pre-migration networks, difficulty establishing new networks because of their limited language and cultural proficiency. They might have limited financial resources. There could be some, like tricky intergenerational dynamics and, life stresses in general post migration. And then there are some undocumented caregivers as well who might fear accessing public benefits such as Medicaid, because of the concerns that it could negatively impact their immigration and legal status. So these are some of the challenges associated with immigration related and legal status. And then let's finally talk about caregiver isolation and stigma. Asian American caregivers experience stigma, perceived stigma and discrimination. Um, Now, saving face is a very broad term which is linked with cultural values such as honor, or its opposite, which is humiliation and disgrace. And saving face may carry different levels of meaning, to an individual with disability and to their families. But it most often it involves hiding a disability within the family, or the AAPI community, and thus could, deny access to much needed supports and resources for people with disabilities. Now, stigma that is experienced or anticipated, what it does is it leads to this vulnerability to poorer outcomes, and it leads to lower service access and engagement, and this results in delays in, seeking support. In addition, there has been this increased stigma and discrimination, especially during the COVID pandemic, with more Asian hates. You know, uh, in addition, the stress and burden of language and cultural differences, they can really lead to loneliness and emotional and physical exhaustion. And then there is experience of mental health challenges and therefore caregiver isolation. So these are some of the challenges that are faced by AAPI caregivers. Now let's talk about In addition to all these challenges that we have talked about, the AAPI community also faces structural and institutional barriers. And they face multiple systemic challenges, that really limit their ability to access appropriate care. And these barriers, they could be embedded within healthcare or social services or public policy systems. And some of the challenges that we have already seen so far, they again lead to these structural and institution barriers. You know, the challenges of racial and socioeconomic barriers, they're really intertwined. So when we look at the institutional racism and socioeconomic inequality, these are usually manifested geographically in provision of services. There are broader systemic and structural barriers in, uh, especially experienced by low-income minorities with limited resources. Um, the institutional racism and socioeconomic inequality, they may reinforce institutional responses to minorities and the resources available. Now, for example, differences in resources in urban areas versus suburban white neighborhoods. That's one of the examples. Now, Asian American and AAPI caregivers therefore experience greater unmet needs and difficulty gaining access and negotiating with institutions, and that includes again social services, healthcare, or education, for example. Next, many mainstream programs, they fail to reflect the cultural norms, caregiving expectations, and stigma around disability prevalent in Asian cultures. There is very limited supply of ethnic specific services. There is lack of collaboration among service providers. There's limited staff training on culturally competent practices, and these all may prevent service providers from delivering appropriate services to AAPI caregivers. As a result, the AAPI families often, they perceive services as either irrelevant or unwelcoming, and therefore they underutilize these resources. Um, Next, despite legislative and policy regulations, healthcare and other systems, they may not have appropriate mechanisms to adequately address language and cultural barriers. Now, for example, because of the limited English proficiency among many caregivers, it really becomes difficult for them to navigate complex healthcare and disability service systems. Now, the lack of interpreters or translated materials again limits their understanding of available services and eligibility requirements. And then finally, AAPI populations are often aggregated into a single racial category. And this makes subgroup specific needs, this masks subgroup specific needs, and that leads to, them being excluded either in policy design or resource allocation. And this again contributes to, systemic invisibility in caregiver policy conversations. So these are some of the structural and institutional barriers. Now, let's look at the unmet needs of caregivers, AAPI caregivers, through this context of, information about them and the challenges that they face and the barriers that they face. One of the biggest unmet needs is access to respite care. You know, as I already mentioned to you before, in many of these AAPI cultures, caregiving is viewed as a filial duty. And this value, combined with concerns about losing face, as I already mentioned, this may lead to rejection of respite services even when needed. Many caregivers are also unaware that these respite care services exist, or they believe that they are ineligible due to immigration status or maybe their income. And public outreach really often fails to reach these AAPI communities effectively, especially those who are like linguistically isolated. um, and then the next is the cultural and linguistic supports. Mainstream supports and services, they often lack linguistic accessibility, as I already mentioned before. There's lack of cultural sensitivity, and there is limited staff with appropriate training. And this disconnect leads to discomfort or distrust among AAPI caregivers when they consider about external care providers. Now, navigation of disability and healthcare systems is one of the biggest, unmet needs. You know, the AAPI caregivers, they're usually unfamiliar with the healthcare systems, the insurance system, or financing, and that can be challenging for them. The use of, for example, health related policies, forms, and other supportive services, they can really be a challenge for immigrant caregivers. Moreover, the role of caregivers may require, obtaining support and assistance through formal healthcare systems, where outside help or intervention may be needed to gain access to important resources. But excessive paperwork, administrative processes, and that could lead to confusion, and especially when the individual or the caregiver has a poor understanding of English. Now this process really becomes daunting, and this may again result in them failing to meet deadlines, wrong forms being completed, insurance claims being rejected, all of this adding more pressure and expense to them. And then let's talk about future planning and legal resources. And that includes guardianship, financial planning, supported decision making, and long term care arrangements. And that is a critical yet often overlooked aspect of caregiving for individuals with disabilities, and especially for AAPI caregivers. This is really underserved due to several intersecting cultural, linguistic, and systemic barriers that we have already talked about. The AAPI immigrant caregivers, they usually lack help and support from their families of origin, and that may cause additional issues than it would be in American born individuals due to the cultural norm, that AAPI individuals are more family oriented and prefer to consider their family as part of their support system. And many of the AAPI caregivers also report low awareness of available legal and planning resources, whether that could be special needs trusts, estate planning, or, disability related legal rights. The language barriers and lack of culturally tailored materials, they definitely contribute to this gap. Additionally, non-English speaking families, they may encounter greater difficulties in accessing this information due to language barriers, as we already talked about. Now, let's talk about peer support and community building. Immigrant caregivers who are providing care for their children with disabilities, they may feel a lack of support and feeling of isolation. These feelings may be because of many factors, including shift in the family dynamics, fear of stigmatization, lack of knowledge about support groups, or linguistic and cultural differences that I keep bringing about again and again. But these are some of the major unmet needs. Let's go to how can service providers now better support AAPI caregivers? We have looked at all the challenges, barriers, and the unmet needs, but what can service providers do? I think building mutual understanding and trust between service providers and AAPI caregivers is important for overcoming, personal barriers to use of services. Outreach and educational programs, collaboration with community leaders, use of API staff, and use of the individual with disability or their caregivers native language may kind of reduce some of these barriers. And it's really important to develop translated materials for resources and other materials. I cannot underscore that enough. In language materials, they help reduce the they help kind of mitigate the limited opportunities to speak to providers due to time constraints. You know, in office materials are seen by API older adults as the most impactful in providing health related information, according to AARP. For example, including translating brochures and handouts, that describe services and eligibility criteria into multiple AAPI languages might be useful. The service providers need to provide culturally competent services and resources, which again includes dissemination of culturally competent materials for training and information, affordable and in language referrals. And service providers need to train staff to provide high quality and culturally sensitive services. They need to train community health workers to serve as family navigators and cultural brokers. Um, the next that they need to do is, as I told you, about in language materials, but also in language caregiver support groups and maybe education or training workshops. AAPI caregivers benefit from additional emotional and psychological support from support groups. They help in resolving social and linguistic isolation. They provide support network for the caregivers who are less proficient in English. Then so it's really important that this in language caregiver support groups exist and more emerge. And then finally, providers, they should also collaborate with community-based organizations and local service providers on the best ways to support caregivers and, the individuals with disabilities through adequate coordination. The presence of service providers in the local communities, through their participation in like social gatherings or community oriented radio station talk shows, maybe example, they may increase the caregivers awareness about services. What must happen in research that focuses on AAPI caregivers? I think, first of all, there needs to be disaggregated data across ethnic subgroups, which we already talked about before. Future research should disaggregate data to understand subgroup specific differences, experiences, challenges, and needs. There needs to be more culturally tailored interventions. Very few studies exist that have tested or evaluated many such interventions specifically adapted for AAPI caregivers. Research should focus on developing, implementing, and scaling culturally tailored programs. And I will talk to you in a bit about one of the intervention studies that I'm leading. And then there needs to be, access and use of formal services. There is limited research on how AAPI caregivers access disability related services such as respite care that I already mentioned, maybe special education, adult day programs, case management. So, studies should examine barriers in accessing those services. More studies are needed on the impact on mental health of API families, including depression, anxiety, and caregiving stress. And then few studies explore how immigration status, acculturation level, and generational differences affect caregiving dynamics. So there needs to be more studies on that. Some of the policy recommendations that I would like to provide for AAPI communities is one, policymakers should allocate funding, to develop caregiver support services that are linguistically accessible and culturally relevant. Policymakers need to mandate disaggregated data collection, and there needs to be an expansion of access to formal services such as respite care, mental health services. And these services must be trauma informed, stigma sensitive, and available without any strict eligibility restrictions. You know, um, there needs to be more engagement of AAPI communities in policy making and program design, in the form of maybe advisory boards, community consultations, maybe co-design efforts to ensure policies are responsive and trusted. And then, a lot of cultural competency training needs to be provided across systems. These are some of the policy recommendations. Now, let me very briefly talk to you about two research projects that I'm involved with in UIC that kind of demonstrate what we have been doing. Before we go into that, I quickly want to kind of, you know, showcase my research interests and positionality. My life experiences and education have shaped my identity. My personal and professional experiences have shaped my interests in disability studies and caregiving research. If you see the slide here, this is the slide that has the picture of my mother in law and my sister in law. My mother in law is the primary caregiver of my sister in law who has an intellectual disability. And I've seen my mother in law, struggling with her role as a caregiver to a person with intellectual disability because of the limited supports and services that she has and her needs not being met. So that kind of shaped my interest in caregiving research. So my research interests include family support and caregiving, a specific focus on intellectual and developmental disabilities, health promotion, health disparities, and culturally tailored interventions. So, a brief description about the study called Mind Walk. It's a mindful walking intervention for older South Asian family caregivers of people with intellectual and developmental disabilities. We have a research team at UIC that's working on this intervention. Older South Asian family caregivers, they experience elevated psychological stress, as I already mentioned to you before, due to caregiving responsibilities and also additional factors, as I mentioned, like lack of services, cultural and linguistic barriers, and so forth. So this intervention really tests the effectiveness of the mindful walking intervention in improving well-being for older South Asian caregivers who experience stress. It's a randomized control pilot study, and the primary aim is to evaluate the feasibility and acceptability of the intervention. It's a culturally tailored intervention. And then the secondary aim is really to evaluate the intervention to examine preliminary efficacy in reducing stress, improving cognitive function, increase in physical activity, and increase self efficacy. Mm, yeah, as I mentioned to you before, it's a 12-week mindful walking intervention study, and we really hope that, this study will help, come up with this culturally adapted intervention of mindful walking, which already exists, but it was never adapted to a South Asian population. So we are really hoping that this will be effective. Um, I wouldn't like to go much in detail because of shortage of time, but uh, just to let you know, it has two phases. Where the first phase, where we finalize the intervention protocol, we have already done that, and right now we are in phase two, which is the implementation of intervention. And right now we are still recruiting, screening, consenting, conducting assessments, then randomizing the participants into a mindful walking group versus control group. And then hopefully we will do the data analysis in a few months and we will disseminate the results. The intervention itself includes a mindful walking training where participants can download and watch the weekly modules on a teachable platform. There's a prescribed mindful walking regimen, which is the second part of the intervention, second component, where participants walk for at least 150 minutes per week with at least 50 minutes of mindful walking. The participants also record we provide them with Fitbit. They record their Fitbit data and their walking experience in an activity logbook. And then participants also receive motivational messages, motivational and reminder text messages, and also weekly check in calls or texts for accountability. And so the outcome measures are perceived stress, cognition, attention, and executive functioning, physical activity, and self efficacy. Another project that I'm part of, whose PI is Dr. Mansha Mirza, is planning early for aging and caregiving with ease, meeting the information needs of dementia caregivers, also called Peace of Mind. It's a research and service project funded by the Illinois Department of Public Health. And the overall goal of this project is to develop and disseminate information materials on dementia care for diverse caregivers, They can be of Southeast Asian and South Asian Americans and also African Americans. We have conducted focus groups with community leaders and caregivers of people with, Alzheimer's and Alzheimer's disease and related dementias. We have consulted with community advisory boards and academic experts. We are culturally adapting the dementia caregiving series curriculum that was developed by the Michigan Department of Health and Human Services with funding from the Administration for Community Living, National Alzheimer's and Dementia Resource Center. And we will be delivering and evaluating the adapted curriculum in the form of in person, online, hybrid group workshops. We are right now working on delivering this workshop to South Asian communities. We have already done workshops with East Asian communities and African American communities. Um, so finally, what are the key takeaways from this presentation? I think AAPI caregivers provide essential care, but face unique cultural, structural, and institutional challenges, as I discussed before. Language barriers, stigma, and lack of culturally appropriate services, they often prevent access to support. Significant unmet needs include, as I mentioned before, respite care, mental health services, and legal future planning resources. And it's really important to build culturally responsive systems and policies to promote AAPI caregiver well-being and equity. And some of the components for call to action are we need to collaborate with AAPI communities to co-create solutions, advocate for policy changes that reflect the diversity and needs of AAPI caregivers, and we need to prioritize inclusive research and service design. These are some of the references. And thank you for the opportunity to present on this topic. And this slide shows the MindWalk research study flyer. We are still recruiting participants, and you can scan the QR code for more information. Especially if anyone is interested to participate, they can scan and take a screening, complete a screening questionnaire if they are interested in the study. So thank you very much.
Thank you so much for your presentation today, Dr. Murthy. We have some time to answer some questions that we received throughout your presentation. So let's get into them. Okay. The first question is, how do you plan to build connections to do research on AAPI caregivers of people with disabilities?
Um, you know, it's very important to build authentic and sustainable relationships, and it's essential to doing meaningful research with the API caregivers. My first step is always to engage with, trusted community organizations that already support AAPI families, such as cultural centers, disability advocacy groups, faith-based institutions, and also some of the national centers. Um, Also, there is one thing that I found is a registry called Care Registry that is being done by University of California, San Francisco. And this registry actually helps with, recruiting participants, especially the AAPI caregivers. Then in addition to that, I really plan to, what I do is spend time listening to the priorities and concerns of the API caregivers before finalizing any research questions. And that really kind of directs me towards using, community-based participatory research approach, where caregivers and community members, they're not just participants but also collaborators in shaping the study. And so that means co-developing materials, sharing decision making power, and ensuring results are shared back in accessible, culturally respectful ways. So and in addition to that, like building a research team that includes bilingual and bicultural staff to support trust and language access. So these are some of the ways to build connections to do research on, especially research. That's because I'm a researcher on AAPI caregivers of people with disabilities. I hope that answers the question.
I think so. Yes. Thank you.
Yeah, that's a great question, though.
Thank you. Um, the next question is, do you know of anyone who, or is there an organization or institution that's compiled a glossary of terms that lists the word disability and or person with disability translated into languages other than English, especially Asian languages? If not, how can we all help by compiling and vetting such a glossary together? For example, in English, the disability community encourages saying person with disabilities instead of disabled person.
Mm-hmm.
So vetting translations into languages other than English will help standardize and model positive concepts.
Mm-hmm. Yeah, that's a great point. Before I let you know of some of the organizations, again, we have to remember that, like disability as a word doesn't translate exactly in different languages. And so, when we start developing the glossaries, it's very important to be mindful of that, some of the terms related to disability in the American system don't translate well because of the different cultural norms and different cultures. I have to tell you the example of my own dissertation. I did a strengths based needs assessment of caregivers of people with intellectual and developmental disabilities in India. And when I actually translated the materials, the research materials to my native language, I had a hard time translating even simple words like strengths based or needs assessment or disability. So we have to be very mindful of that. Having said that, some of the organizations, I'm not sure if they have glossaries, but I know that they have a lot of resources on different disabilities. And one of them is uh, I don't know if what is it called, Asian Americans Advancing Justice. Then there is Asian Americans, it's called AAPIDD of California, which is Asian Americans with Disabilities in California. And then there is some resources that are available on the website of National Council of Asian Pacific Americans. These are some of the organizations that I'm trying to think of on top of my head just now, but I can kind of send some other resources if needed to anyone who emails me. So if you see my email, please, I'm more than happy to, like answer your questions. Please email me and I can provide you more resources.
That's great. Thank you. Um, okay, next question. How do you navigate cultural sensitivity and adapt interventions to be culturally appropriate for AAPI communities?
Now, that's a great question again, and it really requires a very thoughtful and nuanced approach. I think it is really important to take the time to understand the cultural values, beliefs, and practices of AAPI communities, respect them, and then incorporate them into interventions. Now, since AAPI culture is collectivistic and family centric, it's very important to use community support networks, family centered approaches. And to do that, it's again important to conduct needs assessment of the specific subpopulations and engage with community members and community leaders before adapting any interventions to AAPI communities. Um, some ways of community engagement include, as I mentioned before, setting up advisory boards, which constitute the community members and leaders, conduct listening sessions and focus groups with, AAPI stakeholders, It's also necessary to provide relevant research and resource materials in appropriate AAPI languages. Now, culturally appropriate language and communication styles need to be used. Um, if the materials are in English, then plain language must be used. Um, Outreach and dissemination of interventions need to be tailored to cultural values and priorities. For example, culturally relevant imagery and narratives need to be incorporated. But most important of all, I think staff members involved in delivering interventions, they should be culturally competent and sensitive to the needs of the AAPI community. Um, the staff members, whether it is service or research, the staff members should be provided cultural competency training, cultural humility training, so that their understanding and responsiveness to cultural aspects of South Asians is enhanced. And finally, feedback from participants, if it is research, feedback from clients, if it's service provision, feedback from community members and stakeholders. They need to be sought at, like regular intervals to assess cultural appropriateness, effectiveness, and impact within the AAPI communities. And so that, they can identify areas for improvement and adaptation.